views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hi, thank you all for tuning into this special program. I would like to thank Manhattan's College Counseling and Therapy Department for partnering with BronxNet Television for this panel titled COVID-19 and Impact on You, Strategies, Insights, and Helpful Hints from Thought Leaders. I'm your moderator, Dorissa White. Each of the panelists here today have a wealth of knowledge and experience in the mental health field and can speak to COVID-19's effect on mental health. Without further ado, I would like to introduce our panelists for today. We have Dr. Jennifer Gullesserian, who is the acting chair of the department and the program director for the graduate mental health counseling programs. She is a licensed psychologist and certified school psychologist. Before beginning her teaching career, Dr. Gullesserian trained and worked professionally in a range of mental health settings, including schools, college counseling centers, foster care agencies, outpatient mental health clinics, and hospitals. We have Dr. Ian Levy, who is a New York native, a former high school counselor and director of school counseling programs at Manhattan College. Dr. Levy worked as a school counselor in New York City for 5 years, specifically Manhattan, Brooklyn, and the Bronx. Levy's research examines hip-hop-based practices in schools as a culturally responsive approach to counseling, wherein schools process difficult thoughts and feelings through writing, recording, and performing of emotionally themed music. Dr. Sharon Marianetti-Leeper is a program director for the Marriage and Family Therapy program. She is a licensed marriage and family therapist, as well as a licensed and board-certified art therapist. She has an extensive experience working with individuals and families in outpatient mental health clinics in Brooklyn, Manhattan, and the Bronx. Currently, she runs her own private practice in addition to her work at Manhattan College. We have Randy Slaughter, who will be graduating from the Master's in Mental Health Counseling at the program in September. Before enrolling in Manhattan's college graduate program, Randy worked as an administrator in a local private school for several years. He made the decision to change careers due to his desire to focus more directly on the mental health challenges that has become a more prevalent part of his work with students. Thank you all for joining us today. All right, so without further ado, I would just like to get started with the questions. And this goes for each of you. Anyone can answer. Which recent trends have you observed that have led to the increased need for mental health professionals?
I can respond to that first, and then if any of my colleagues want to build on that, they're more than welcome to. So there's a couple things. When I consider mental health services broadly, one of the things that always sticks out for me is that we know that Black and Brown youth are 1/3 to 1/2 as likely to receive mental health services in comparison with more affluent and mostly white youth. So there's been a need for a large amount of time to provide adequate services for marginalized communities. When we look at that, we also know that there's a need for culturally responsive services, which is partly why I do some of the hip hop work we talked about earlier, right? There's a need to sort of create interventions that respond to the needs and lived experiences of people beyond just generally white folks who receive counseling services at what we would, I guess, consider sort of adequate rates. Beyond that, however, within schools, it's often hard for school counselors to engage in counseling services. And I know that kind of sounds like a silly thing to say, but oftentimes within schools, school counselors are misused and misappropriated with a lot of bureaucratic tasks, like lunch duty. You know, when we consider COVID, a lot of school counselors were delivering laptops to people's houses. Again, these are all like needed services, and we need folks to be in those spaces and supporting students. But that is not necessarily aligned with what the school counselor is supposed to do. So that contributes then to this reality that I had just explained. When young people go to schools, they don't get services, in addition to not receiving services within the community. So I just would sort of say that that's part of why there's been this argument within the school counseling profession to increase the amount of school counselors that are also in schools. So another notable trend is nationally right now, we have around the ratio of students to counselors is about 442 students to one school counselor, right? So there's a huge issue in the ratio. In New York State, we're a little better. We're 291 to 1, which is actually quite good in comparison, but still is not enough, right? And so we need more school counselors in schools. That's also led to the increase. It's a trend that has led to the increase of the need for mental health professionals. But when folks are in schools, they need to be adequately utilized. So I'll just close by saying school counselors function in this broad capacity that's a little bit different than traditional mental health professionals in that they respond to students' social and emotional needs, but that they also respond to career and academic development outcomes of young people. And so it's a little bit more holistic because of their because of the fact that they're situated within educational contexts that change the way in which they deliver services. So it's rooted in a lot of those same sort of like clinical approaches that they learn, but the dissemination of those skills is different to support students holistically. So we need more school counselors who are adequately prepared to respond to the ever-changing needs of young people.
Thank you so much. And also, Dr. Levy, your microphone was rubbing on your shirt a bit. When you talk, can you just grab it a little bit?
Yeah, no problem.
Thank you so much. Okay. Does anybody else want to jump in on that question?
Sure. I'd like to sort of build on what Dr. Levy was saying. So, with regard to school counseling, obviously that's in the educational domain, right, and the school site. And then zooming out to marriage and family therapy, we're really concerned about what's happening in the domestic domain, what's happening at home. So obviously, coronavirus has completely changed the way we work, the way we relate, the way we go to the grocery store, the way we handle sort of our activities of daily living. And our relationships are really experiencing the pressure from all of that. Our intimate relationships, our sibling relationships, any friendships, everything is sort of, not just with regard to coronavirus, but also with some of the social justice issues that we're facing, also with all of the return to work, the job loss, the economic insecurity. It's really compounded every sort of stressor that was already pre-existing, and it's brought it into light. So, we're really all responding to these sort of greater systemic forces of society, and then also on an individual level that we have these intrapsychic forces, the anxiety. I always tell my clients, this is the age of anxiety and the city of anxiety. So New York City, so we're all kind of managing the best we can. We all have our own internal fears, and then we're also trying to meet the needs of those we love. I have a small child who I spent more time on his Zoom pre-K the past few months than I did in my own in my own domain or in my own professional development. And and it sort of takes its toll in how we're sort of managing space and managing time and managing emotions. Marriages and intimate relationships and intimate partnerships have not, some have suffered, some have strengthened. We sort of all need, the new skills are required for this situation, which I don't think, until this point, I think we were all kind of maintaining the best we can, but now, the coronavirus really pushed everything into high relief, whether there were already sort of issues that needed to be attended to, and some maybe we were going along in our normal routes and patterns interpersonally, and now really what I'm seeing in the clinical sense and what I'm hoping to prepare my students for is this idea that when society, when the zeitgeist, when we're under extreme pressure individually and collectively, how are we managing our own anxiety when we're tending to the anxiety of others? And it's really a growing edge for all of us. So there's no dearth of subjects and topics to be anxious about right now in the current in the current world we're experiencing.
Thank you. Does anyone else want to just jump in on that?
I can jump in a sense of a trend. Okay. So a trend, talking about New York State, recent trend is actually the professions of mental health counseling and marriage and family therapy. They're master's level professions, and New York State saw a need to be able to develop more mental health professionals and put them into the community in New York State. So they're newer professions. And I think that it's important just to point out that that is a response to a need and is a trend, that we do have master's level mental health professionals. And that really makes it so that the community has more access to mental health professionals. Before, your options were a psychiatrist, a psychologist, or in New York State, a licensed clinical social worker. Now, individuals have more options. They can seek services from a variety of professionals. And we really want to destigmatize this idea of seeking services and understand that when you seek out a mental health professional, it's important to know that you can seek services from a licensed mental health counselor, a licensed marriage and family therapist, and others master's level mental health professionals. And that is a trend in New York State. New York State saw the need to have more mental health professionals, and it's very challenging to have that at the doctoral level. Not everyone can get a PhD or a PsyD. That is not attainable to everyone. It's more attainable to allow people to get a master's degree and be able to serve in the same way. And so I think that, we're joined today by our student, Randy Slaughter, who's a great example of someone who held a bachelor's degree, wanted to advance his profession, and a master's degree was something that he was able to attain in the time frame and monetarily so that he could get into the profession sooner and serve the community. So the community of New York really has an abundant amount of mental health professionals. And I think our job at Manhattan College is really trying to get as many professionals in the community that will be able to serve and have resources for those living in New York.
Thank you. Randy, I'm not sure if you wanted to join, but feel free.
For sure. I was going to add on to what Dr. Gullesserian is saying about destigmatizing mental health services. What I've seen, at least in my clinical internship, a lot of people are coming for mental health services for the first time ever in life. And these are people who are in their 40s, 50s, and 60s. And so they feel much more comfortable at this point in time to address some of the concerns that have been existing for forever. Whether we're talking about, the stress of poverty, of racism, of violence in the household, of, sexual abuse, and all the other things that kind of have plagued communities. These things are now being seen as something that you can address by going to seek mental health counseling or to see a therapist of any sort. And I think having the opportunity to do that has certainly made it much more prevalent in our field. And I think the uptick you may see might just be people feeling more comfortable addressing it rather than there being more cases of stress or things that are bringing people to the field.
Thank you. The next question, and Dr. Gullesserian and Mr. Slaughter, you actually just touched on it, but we're going to go it was a perfect segue. What current needs observed in our society, specifically right now, today, directly benefit from receiving counseling services? Anyone can join in. It's not directed to anyone specifically.
Unfortunately for me, the majority of my clients, a large majority of my clients, have dealt with all types of abuse and trauma in their life experiences, and I think that is a societal issue, and you see that over and over and over again, particularly in poor communities and communities that have consistently silenced sort of that sort of trauma from coming forward. So you see that as for me, I've seen that, I should say, as part of a trend, and something needs to be addressed, certainly through mental health counseling, but also through all types of other clinical services as well. The other thing I think, and I think to your first question, and sort of echo what Dr. Levy was saying, in my experience as an educator, just the pressure and stress that students are under, whether it be to get into a particular college or to maintain a certain grade point average, or add in all these other things beyond the classroom to their experience, really is weighing on students' experiences. And so you see teenagers even starting to experience some of the stress and some of the cracks in sort of the ability to maintain and cope much earlier in life than I remember them as a student. And I can say that the experience that they have is much more rich than mine was, but also much more heavy, much more laden with potential pitfalls. And so having those things on the plates of youngsters has also been part of the trend as well.
Yeah, and just to build on that, thank you, Randy. Like the need to respond to racial trauma is also quite significant. And I know Randy and I have done some research around this concept a bit, but there's an increased need as a result of this summer. There's no way that young people, when we think about schools specifically and school counselors, not that this is not a need to be addressed everywhere, but my lens is always through school. But when we think about what's been happening this summer with regards to the racial injustices that we've been privy to and the social unrest, there's no way that that's not bringing up feelings for a large amount of young people, particularly black and brown youth that are going to reenter schools in the next few weeks, regarding their own experiences or experiences of their family members that have looked quite similar to the ones that have been broadcasted via different media outlets. And so I think the need to respond to just the experience of racial trauma is a huge part of the school counselor's role within schools. And then another piece that's quite important, beyond just the actual physical violence that we've seen and the sort of the traumatic responses that brings up, a lot of the focus right now, particularly among school counselors, has been this idea of anti-racist school counseling and how we pinpoint different structures within schools that create inequities based on race for young people. And so it's part of the school counselor's responsibility to disaggregate data and to see how different types of programs, whether that's like placement in AP courses, whether that's just the receipt of general counseling services within schools, who's given IEPs, individualized education plans or not. How do all of these, or just discipline policies broadly, what does the data for all of these look like? The school counselor is privy to that. When we look at that by race, are there folks that either receive unjustly or inadequately miss out on opportunities based on race? And then what role can school counselors play in shifting policy within schools to create sort of equitable outcomes for all young people? And so race and sort of the experience of systemic racism is really part of the school counselor's role. And that requires not only responding to trauma, but also responding to policies that create inequities. And I think that that's very much part of the school counselor's role. And it is arguably more important now than it has ever been. And it is necessary and right in our face. And we need to address it the second we get back into schools and even before and as we plan to return.
If I could add, I think it's important, really putting it in the framework of COVID and what's going on in our society with relation to the pandemic and COVID, is that all of our clients and students that we work with professionally really have a different baseline for traumas they've experienced. As Randy touched upon, he in his clinical internship served a community that was very traumatized, and it was the very first time that they were seeking services. I think that we have to understand that everyone has had a different experience and has a different ability to be resilient towards stressors. Everyone has a different experience with life stressors, and the COVID pandemic may be one of the largest stressors that an individual had to experience. They might not have had a traumatic upbringing that others had, and so therefore the impact that this has had upon them is significant. Again, this is the largest stressor that they've ever experienced. Perhaps being pulled out of school, being pulled out of their workplace, economic hardships, the loss of income, the loss of a home, the loss of an apartment, illness of family members, losing loved ones. This has brought upon trauma to our entire society and to everyone in the world. And I think that we as mental health professionals really understand that everyone has a different tolerance to stress. Everyone has a different tool bag for coping. And I think that we really understand and appreciate that everyone comes from a different baseline. So not only are people experiencing the pandemic and COVID and this idea of social isolation, but now we are also having all of this over the summer, everything that Dr. Levy was talking about, the voices that were being heard, and adding to this things that everyone already knew, but obviously it was being highlighted and brought to everyone's attention. So there was all of these multiple forces going on at the same time and really colliding for a lot of individuals. And I think it became very overwhelming that individuals could tolerate up to a certain point. They have a frustration tolerance. They could tolerate this much, but then a little bit more got added and a little bit more got added, and individuals become so overwhelmed. So I think, as Randy pointed out, there is this destigmatization of mental health services because at a point, an individual understands they no longer can cope on their own. They no longer can cope by just speaking to a family member. They really need to seek professional services to help guide them through the experiences of what's happening right now. And they need to be able to rely on a professional that can help them develop coping skills so that they can overcome. We can't change. We can't make the pandemic go away. We cannot make racial injustice go away. But we can help an individual cope with their life experiences. And I think I just want to add that that's really what's a need of our society right now.
Yeah, and may I add that speaking to this idea of coping mechanisms, we're all having to learn new coping mechanisms. There is no playbook for a global pandemic. Even if we had one, it just kind of went out the window. So we're all trying to do the best we can. So with regard to issues surrounding the family, substance abuse is often an issue that is dealt with on a family level, right? Even though an individual may be struggling with drug and alcohol abuse or dependence, it essentially becomes a family affair. And, and as does any sort of abuse, child abuse, any sort of addiction, spousal abuse, intimate partner violence. So, the ways in which the family sort of becomes a crucible for working out some of these greater political, social justice issues. And, the power differentials within the family get attended to in the marriage and family therapy milieu. They get attended to in ways that sort of take these family secrets and make them a little bit more, it's sort of the elephant in the room. Everybody knows that these are the sort of the rules and the regulations of the family. They're unspoken. They're either kept in secrecy. And we sort of, we give voice to it, and we give voice to members who are arguably, not very powerful, either because of their age or their socioeconomic status within the family itself. So it's sort of, we're always sort of telescoping between the individual and the collective. And with regard to coping mechanisms right now, I'm finding that some families, some individuals, to speak to what Dr. Gullesserian said, we all have a different threshold for the stress that we're enduring. Some individuals are managing and they're developing new coping skills. Some people have started running. Some people have started really turning to physical release for some of the psycho-emotional stress that they're experiencing. And other people are really not doing very well. So I think we all have to talk about the struggles. We can't pretend that it's not happening. We have to give voice to the struggles and really, really see where have we been up until this point and where are we going and how are we adapting to this new environment? I mean, the coronavirus is one stressor, but we have plenty of environmental distress coming our way. Dr. Gullesserian and myself lost power. Randy, I'm not sure if you lost power last week. And that was just another added layer of stress, not having air conditioning, not having an elevator in my building, not having a refrigerator that was working, in addition to everything else that's been sort of coming down the pike since mid-March, right? So again, all of our coping mechanisms are being demanded on higher levels than I think they've ever have been before.
And just to add, with coping mechanisms, we talk about adaptive coping mechanisms and maladaptive coping mechanisms. So while some who have experienced stressors in their life before, trauma, stressors, they may have developed adaptive coping skills. They may channel their energy into the arts, or through art, through music, through exercise, through socialization, through putting themselves into an academic pursuit, returning to school, pursuing a degree, through their professional means. But others have developed maladaptive coping skills, where they are using substances to cope, where there is more violence within a household, where there's more explosive anger, there's more rage, there's more threats of violence, more harm. Individuals who are sort of reverting back to really unhealthy ways of managing their stress, which is causing really danger to themselves. And if we talk about the family system, danger to the family. And if we talk about the school, could be danger to the school system, in a sense of making sure that those individuals who have perhaps had a history of maladaptive coping are really checked in upon and really provided support to get them through this period of time, which again, none of us could have foreseen all of this happening. There is no playbook. We do not know how to cope with a pandemic. Most of us, this is the first time in our lifetime that we've had something that affected the entire world at the same time. So it's not as if you can pick up a book off the shelf and read self-help, how am I supposed to cope with a global pandemic? It's not available. So I think that it's important to go to the mental health professionals who have the experience and can really guide you individually or as a collective family on what will work for you personally. What are parts of you that are strengths that we can work off of to help you to be able to endure? Because really this is about enduring. This is not about making these stressors go away. It's about helping an individual endure and cope and be able to continue on. We as humans need to be able to continue to function. We need to be able to eat and sleep and socialize and work and learn. We need to be able to do these basic human things. And a lot of individuals are not able to do that right now. They are completely frozen. There are these barriers that are in front of them. And I think that seeking support from a mental health professional is the way to remove some of those barriers.
Thank you so much, all of you. The great answers. Just moving along here. This one is really directed to Dr. Gullesserian and Dr. Marianetti-Leeper, but anyone can join in. Have you noticed an increase in applicants to your program since March?
I think I'll speak to that as the acting chair of the department representing all three programs: school counseling, mental health counseling, and marriage and family therapy. Yes, we have definitely noticed an increase in applicants to our programs. It is not surprising. I don't think any of us are surprised. And I think there's many reasons for it. I think that individuals who have always sort of thought they were, thinking about, maybe they were in another career and they thought about, I really think that I've always been drawn to the mental health field, that they are now taking that leap. They sort of had that extra push. I've been reading so many essays that have stated, I've always knew that I'm interested in the mental health field, or I'm interested in serving. Maybe they're a teacher in a school, they have a teaching certification, but they found themselves wanting to talk to the students in a way that's different than educating them. They want to really be able to counsel them and work with them as a school counselor, so they have decided to make that professional change. I think others, we have many people who work at the bachelor's level within the mental health field doing a variety of jobs, and they know that they need to pursue the license in order to be able to serve and do counseling to the direct individual or the family. So definitely I've seen an increase. We've all three, as the three program directors for the three programs at Manhattan College, have seen an increase in our applicants. We are so happy because we want to be able to develop more professionals. We feel that we produced a student that's going to be incredibly valuable to New York State. Our students generally will be licensed or certified in New York State. And we think that we can really develop a student that will have the skill set to be able to serve the community and help people grow in the profession.
And I will add that marriage and family therapy as a practice profession in New York State is kind of one of the new kids on the block. I'm also a licensed creative arts therapist in New York State, and that actually was a license before LMFT was widely recognized. We don't pit ourselves against social workers. We're all sort of service providers. But I will say I did my master's degree in Seattle, Washington, and on the West Coast in California, Oregon, and Washington State, LMFT is the LMFT license is better recognized as the sort of the relational license, that you go to for not just your intrapsychic distress, depression, anxiety, but also a degree of interpersonal distress that you're experiencing. So in New York State, and MFT is the most recent program to be added at Manhattan College, but in New York State, really the MFT awareness and consciousness is growing. It's been better established in certain parts, notably California. But so especially at this time, I think obviously the distress that people are experiencing in the home and in the interpersonal relationships is really pushing an awareness of how mental health is affected, how relationships affect our mental health greatly.
Thank you. How has the move to telehealth due to COVID-19 impacted the disbursement of mental health services? And this is to anyone, no one specifically.
Well, I can speak to that a little bit. I will say in my own private practice, at first I was a bit skeptical about taking on new clients that I hadn't met in vivo, as we say, people I hadn't met, sat in a room with. But I have to tell you, it's actually quite an intimate experience. You know, even though, like, let's take this experience we're having currently, for example, you know, we're definitely getting the point across, right? So, you know, there's something about doing, this might sound a little off-putting, but doing couples therapy in their home, you know, for me to make a house visit is not realistic, but to see them in their home state, and then having the Zoom experience or the FaceTime or whatever telehealth platform people are using, it sort of adds has a layer of, you know, people are more at ease. They didn't have to just commute, you know, for an hour on the one train to get to your office. So there's something, as skeptical as I was about doing it, or even having a phone session, there's a degree of defensiveness that is lowered with regard, and it could be, you know, reflecting also the current zeitgeist as well, that people are hungry for mental health services. They're hungry for these conversations we're having. They want to make substantive changes in their lives, and they're sort of taking the opportunity of all this turmoil to set it straight, you know, to get on a proper path for some of their relationships, their work relationships, their work intention, and some of their multiple identities as well, their professional identities, their personal identities. So I have to say that I've been pleasantly surprised. It's going to be interesting to see what happens when we go back into the office and see how that transition is made as well. But I'm curious to hear what others have to say about this as well.
I wanted to add regarding telehealth, I think that we always talk about there's so many barriers to seeking services, barriers to seeking mental health services. And a lot of times the barriers are, especially if we're talking about in New York City, New York State, is availability. So I know we always talk about urban, but in rural communities in New York State, it's very hard to find a mental health professional in your community. They usually have a very long wait list. The community agencies are packed, huge wait lists, and they're not able to serve their clients. So if they're able to now, because of telehealth, seek services, it may be in the neighboring county or even not neighboring county, they're able to access mental health professionals that they never would have had access before. It removes that barrier of availability. When we talk about in urban communities, when we talk about more densely populated communities where we have more mental health services like in New York City, time has been a barrier, and availability for a parent to get a child to an appointment after school while working has been a huge barrier. So, that you don't have the transportation. You can join, as Dr. Marianetti-Leeper, from your home. You can seek your mental health services in home. And a lot of agencies have tried to switch to in-home services, but again, that has to be funded, and that can be proved challenging. When I worked in foster care, I did do in-home counseling. I went to the homes and met in the living room and was able to develop relationships with my clients because it removed barriers. Maybe the parent is physically disabled or elderly or unable to bring that child to session. They didn't have to leave the home to do that. But now with telehealth, again, you can see your clients in their home. It removes transportation, time. I think it will help with the idea of availability of practitioners because it will reduce wait lists, because you can see people not just in your immediate community if transportation or time was an issue before. So I think that telehealth is actually, and I think medical professionals are learning this too, it's removed a lot of barriers for patients to see their medical professionals. It also makes it more timely that you can see you don't have to wait so long for an appointment. It doesn't remove, though, the barrier of finances, insurance. Of course, this has to be discussed. Where Randy completed his internship was community-based, and it was free. It was providing free mental health services. And they, of course, had a very long wait list, and they had to limit the amount of sessions they could provide. But at least the members of that community were able to have mental health services. It got them started. They could take their first step in and realize that they really did benefit and really enjoyed going to this service, which was free and limited. And then they were able to navigate, unfortunately, the very difficult world of insurance to be able to. But that's what also his community-based agency did, was helped with navigating and finding providers that those patients could transition to. So I think telehealth has removed some of the barriers, which has helped for mental health access, but of course, not all of them.
I'll just add very briefly, within schools, it's not as much telehealth, but it is this idea of virtual learning and how school counselors operate within that virtual world as well, to provide mental health services as well as the other services that I mentioned, right? Support students in their career development and their academic development. And that has been happening fairly successfully in some cases through things like Google Classroom, right? And some districts use Zoom, others, there's been some debates around adequate services to use, adequate online services to use that maintain confidentiality. And that has been differentiated depending on the service, right? So if I'm doing just an academic meeting, I might be able to use like a Google Hangout kind of a thing. But that is different tremendously by district. But I just want to say that online space within schools has also been something that we've had to navigate. And what we've seen, I think, what has stuck out to me at least, as I've worked with our students who are doing their internships in schools, is that schools that were already online, schools that already used Google Classrooms and already had some sort of an infrastructure built online, were able to navigate that remote learning component of COVID a lot more easily than schools that had not had that infrastructure set up prior and kind of were scrambling to get things online to then respond to the needs of students. And so not exactly telehealth, but certainly remote learning is part of the school counselor's purview, especially now. And it is recommended, even if things are back in person, that we maintain this online space to adequately support all students.
Okay, so to Dr. Gullesserian's point about lack of insurance, that brings me actually to my next question. I feel like you're just like segueing for me. But many Bronxites do not have insurance that covers mental health services. How does your program address these or address the uninsured or these needs?
Well, that is extremely challenging. I don't think our program necessarily addresses it because we can't, in a sense, change that, but we can make and develop mental health professionals who are very socially conscious, right? Who are going to be advocates for the profession, who are going to work with the state, lobby with the state in order to make sure there are more available services. So, they always say, it only takes one person. Well, in this case, it doesn't take one person. It takes a whole professional community to really advocate and push for funding. So I know that, for example, NYMCA, the New York State Mental Health Counselors, they are constantly having advocacy days, partnering with other mental health organizations, the larger organizations within New York State, to push Albany for funding. So every time funding gets cut, and when I say funding, I mean funding to community-based agencies. So again, community-based agencies that might be able to provide free services, that's usually through a grant. It's usually through a grant, and that's time limited, but that grant can be through different companies that provide the grant, or it can be state funded. So I think it's really important that we develop our graduates to be aware of this. And I think we talk about it. We talk about the inequity all the time about who gets served and who doesn't, and who can have access to mental health services. For example, putting in students into settings as Randy was. Randy was an intern, and obviously he's an unpaid intern, right? So he's an intern completing his hours within his mental health counseling program, and he was able to be the practitioner that could see clients, and that's another reason the services were free. So we do put our interns in settings where the intern is not being paid, thus it's not a cost to the agency, and there's another individual that can be provided services. And I think Randy can speak to that, about how valuable that experience was to be able to serve someone at no cost. We also, our students who develop into private practice, we always talk to them about sliding scale. So you can do out-of-pocket sliding scale, and you can serve a population for a reduced fee. So you can make sure that individuals who come to your practice are still able to be seeking services even without insurance. It would be out of pocket and perhaps the same amount that they might pay for their copay. But I think that you can go at it all systemically. We can go from the top and talk about the hierarchy, go to Albany, get policies, get more funding, but we can also go to the bottom, to the individual practitioner, and make sure there are more practitioners who will work with sliding scale, adjusting their fees to serve clients. And I think that, I'd love Randy to speak to his experience at his community-based agency to talk about what that's like and how they really were able to fund free services for individuals in the community.
Well, that was really a powerful experience for me, both as a student at the time, and also part of my my move into mental health services field was looking to be able to have a better impact on my community. Recognizing that there were so many people who were untreated and undiagnosed in some ways, with dealing with mental health struggles and challenges, and being able to be part of that was really important. The fact that the services were free was also very amazing, because of the fact that you had a wealth of people who are willing to try for the first time, right? There was not that financial hurdle to see what might be beneficial about this process for them. And I think that eliminated a major hurdle for some people and brought them in the door. And once we got in the door and started working with people, working with clients, they can start to see some of the benefits of attending to their mental health and having that it be part of their lifelong practice. So part of my learning was also how to help people navigate the system once they left our agency. We had a limit on the number of sessions that we could offer, obviously, because they were free. The waiting list was 3 and 4 months long at most of the time I was there, and having an opportunity to then find other places that they might find free services, or might find people who are willing to do sliding scales, like Dr. Gullesserian was talking about, having the opportunity to really spark that interest in them, but not leave them high and dry was really important for me, and not leave them sort of feeling like I've had these 10 sessions, but now what? It also, I know from my own learning as a counselor, I entered in, and Dr. Gio can speak to this as well. Entered in feeling the pressure to, okay, so how do I get to the bottom of whatever's going on in 10 sessions? Like there's a lot of pressure for that, and recognizing now as this is in my student role, that it's not about solving the problem. It's about creating different methods of coping, and creating this ability for the clients to then find these ways to help themselves, and put practices in place that will continue to benefit them, even if they're not in sessions with a professional, until they're able to get back in front of someone. So it's really important to be able to have access. It's really important to be able to at least give people the opportunity to experience this. And this was one of the things that kind of pulled me out of education and into mental health counseling, was because I felt I was doing some of this sort of work as an administrator, but I was untrained. Right? I didn't have the know-how, but I knew that there were things that were going on that were impediments to my students at the time, ability to be as successful as they could be in their lives. These hurdles were put in place, and it was affecting grades or affecting behavior. And as a layperson, I was trying to sort of triage what was going on, and being able to go to Manhattan College and kind of get the training, and then put in these agencies, the community agencies that allowed me to see clients that were specifically looking to address these issues, was really important for me in my training.
And just to add, looking at it systemically, what Dr. Levy has mentioned, what Dr. Marianetti-Leeper has mentioned, and as well as Randy, is that if you really look at it systemically, one of the biggest barriers to seeking mental health services is access, knowledge of the service. And if you're in a school community as a school counselor, and if you have the ratio of students that Dr. Levy mentioned, you are not able to really meet the needs of each student if they have real mental health needs. And therefore, they need to be referred out. So Randy, in his previous role as an administrator, he's trying to meet their needs within the school setting, but really getting the sense they need to be referred into the community. They need a mental health professional outside of the school setting. But there you go. There becomes the struggle. How do you, if you can't help them in the school, maybe as a school counselor in your role, because you have such a huge ratio and you have to meet their academic goals and you have to meet different types of bureaucratic deadlines and different things to help them with their transcript and graduation, etc. Then, and if the school doesn't have, the schools do not have mental health counselors, licensed mental health counselors, licensed marriage and family therapists cannot be employed in a K through 12 setting. That is currently, they don't have a certification. So you have school psychologists, you have school social workers, and you have school counselors. And those three professions alone within a school cannot meet the mental health needs of their students. So oftentimes they need to be referred out of the building. But getting them access to these services, again, we have very long wait lists. We have families that are unfamiliar with mental health. They don't know who to go to. I need medication for my child. Do I go to a psychologist? No, psychologists cannot prescribe medication. Simple distinguishing between what's a psychiatrist, what's a psychologist. Can I go to a licensed mental health counselor? Can I go to an LMFT? Who can I seek? How do I get help for my child, for myself, for my family? So I think that really systemically, there are barriers. And I think that when we talk about insurance, that is just one. But I think that there's also a barrier from the school into the community. And I think our program, we are very aware of this. We teach our students to be systemic thinkers, to be aware of what's happening at every level from society and inward into the individual. So we are really trying to develop mental health professionals who have a real awareness of systemic factors and, to the best of our ability, try to navigate and serve the community.
And I think as we consider that navigation of those systemic factors, what comes to mind is the need to advocate, right? So when I think about school counselors, I mean, what better, their services are limited, right? Like school counselors can only meet, as Dr. Gullesserian was speaking to, they can only meet sort of a sliver of emotion, of sort of mental health needs before they need to refer out. But even that sliver is not adequately met a lot of the time. And it's because of the ratio, which again is because of funding from the state. There's not enough money to put school counselors in schools. We need more money. We should not be putting more cops in schools right now. We should be putting more counselors in schools right now, right? Like these are the things that we know. But in addition to that, school counselors need to be able to then see these inequities and advocate for them. So what does that mean? That means that they need to advocate for stronger partnerships with clinics and mental health agencies outside of the school that visit the school, that meet the administration, so there's a real partnership so we can have that referral process and we're not just like scrambling every time we need to refer somebody or sending somebody to a hospital that's overloaded. Like we need adequate services that we can refer to, but also school counselors can meet these needs in ways that they might not be thinking about, right? So meeting mental health needs in schools as a school counselor is not just individual and group counseling. It's also in like school-wide initiatives and a bunch of different classroom-based practices that we can engage in. A lot of that knowledge, however, is maintained by acquiring additional professional development support, right? And so when we think about funding, there's very minimal amount of funding placed in professional development services for school counselors, particularly in comparison with teachers. There's like a huge budget for that. And school counselors can speak to that. A lot of times when there's PDs, professional developments in schools that they attend after school, they're very teacher focused. They're not necessarily relevant to the school counselor's role. And so school counselors are responsible for finding those professional developments that they want to go to, those conferences that they want to go to, and then advocating to their administration to find money. Because guess what? There's always money, and principals and admin, if they see the value in it, can find a way to appropriate funds and move them to a place to support you. But you have to advocate for those. And so I think about advocacy to truly meet the mental health needs of students in schools, and then also to build the proper pipelines to refer students outside of schools so they can receive robust services in the way that Dr. Gullesserian and Randy were describing.
I think something that also makes our program very unique is that our school counseling students, once they receive a master's in school counseling, they can stay with us and get our advanced certificate in mental health counseling. It's really the bridge. And as Dr. Levy mentioned, a lot of them don't have that provided professionally as a school counselor through whoever employs them. So they seek it independently. They know that they want these additional skill set in mental health. They want to be able to serve their students' mental health needs as a school counselor, and they want that additional training. So many of our students will complete our master's degree in school counseling and then stay for the advanced certificate in mental health counseling. That allows them to not only be a certified school counselor, but also a licensed mental health counselor. So they will possess both a certification and a license, as do I, so that you can actually have more knowledge of school counseling and mental health, but also have the flexibility to work with whoever you want to serve within different settings. Again, because licensed mental health counselors are not currently employed in schools, and the school social workers and the school psychologists are already tasked with different jobs, just like the school counselor is tasked. There is not really anyone in a school who's solely available to do counseling that is not mandated. So if a child has an IEP, an individual education plan, they may have counseling, which is mandated, but that counseling is really mandated to help them meet their academic goals. So if something is interfering with them meeting their academic goals, counseling will be added to their individual education plan. But that counseling, again, is really focused for their academic goals, not their overall well-being, their overall functioning. Therefore, I think that it's so important that we think about, as Dr. Levy mentioned, the advocacy, this idea of how do we get more funding into the schools so that we can have more mental health professionals both in the schools, but also more funding to have availability where there are free services in the community, but also helping community-based agencies hire more mental health professionals, making sure that they're able to bring more individuals in so that they can bring that wait list down.
Thank you so much. We're running out of time. We have less than 10 minutes, but I really want to ask this question. What are your takeaways from the pandemic, and what have we learned? Where is there room for improvement in the mental health field?
I think coping skills to navigate uncertainty are incredibly important. And I think that is a sort of outcome that can be focused on in any of the domains that our programs represent. So whether you're engaging as a marriage and family therapist, as a mental health counselor, or a school counselor, supporting clients in preparing, because there's uncertainties in life generally. And as we're seeing this year in particular, they're going to continue to occur. And are we going to be ready the next time something crazy happens, right? Because it will. And can we navigate that, right? And so I think it's a lot of that preventative work in developing coping skills to navigate uncertainties. That sticks out for me as a real learning, point of learning from COVID.
Yeah, I would definitely dovetail with that. There's a degree of frustration tolerance that we're all learning, right? So we're all expanding our sort of behavioral repertoires, as it would, as to how to manage uncertainties. I think this is what we've seen play out on a national political level, which is the CDC doesn't know what its recommendations. Do we wear a mask? Do we not wear a mask? Do we do this? Do we do that? But the same way that science is sort of this evolving picture and this evolving structure, we're asking better questions. Therapy is similar. We're not procuring answers necessarily to life's greatest questions, but I tell my clients the quality of the questions are improving. And if the quality of the questions improve, then that means arguably your experience of the dilemma, of the distress, is also improving as well. Some of these structural issues that we've spoken to, if the first step is to destigmatize within ourselves the impetus to ask for help, to know when we need help, and then to ask for it. And then the structure also has to be supportive of, okay, now this is the type of help you need. This is the conduit to the help you need. It is a top to bottom, bottom to top proposition. But really the first step is this recognition that maybe I do need some help with this right now. And it's gone beyond the family. It's gone beyond my friend set. And it's entirely possible that I need to speak with a professional.
I think adding on to that, just the ability to effectively communicate and being more assertive in communication. I've seen people in much closer proximity to one another for an extended period of time. And I think we develop these practices of the way we kind of get through our day, the way we cope, is sometimes not addressing things or not bringing things forward, and then they kind of build up slowly. What I've seen during COVID is that that buildup happens much more rapidly because you don't have the time to yourself. You don't have the space to get away necessarily to kind of recenter yourself. And so being able to find ways to effectively communicate, to speak your needs and talk about the things that you're struggling with, but also then to find ways to address them in real time and not necessarily have them be something that builds up. I've seen that in my own family for sure. My 8-year-old is bouncing off the walls because she hasn't been outside in a very long time. And so her friends and being able to find ways for her to find language to speak that frustration forward to us as parents and being able to address it and find other ways to then cope. How do we deal with, how we're creative about creating solutions to those problems, and also still being attendant to the severity and the dangers that are out there around this pandemic. And so it's been a great balancing act in that regard, but it's definitely taught us how to communicate better and be more effective in the way we communicate.
And I'll add that I think people have been able to be a little bit more introspective, right? People have to really have a little bit more insight into themselves, because constantly we're being asked, how do you feel about this? How are you doing during the pandemic? How do you feel about this happening in the media or that happening in the media? We're all being asked constantly by our friends, or we're being asked to put it on social media, our opinions about things. So perhaps it's drawing everyone to be a little bit more introspective and a little bit more insightful to really get a sense, because I think before, everyone was caught up in the getting through the day, getting things done, whether you're taking care of children, taking care of a loved one, your job is very demanding, or you're trying to manage financial hardship. You were just surviving, getting through. But now everyone is sort of stopping and trying to get how do I feel about what's going on? Really stop and think, because everyone's asking me, how are you doing during this? How's your family managing? How are your kids? How's your workplace? Are you getting to go back to work? So I think people are really having to stop and think, have a little bit more insight. And some are struggling because a lot of people, they haven't had that. They haven't developed an ability to be introspective. They haven't developed as an adult, perhaps. I always say that some adults, we have some children that are far more introspective than some adults. And so we need everyone to be able to look inside themselves and really know themselves. What is normal for me? Do I normally manage stress this way, or am I managing it not well? Really being able to know what our baseline is. Because I always use baseline. I don't use the word normal. There is no normal. There is your own individual baseline, and you can be way above human or way below depending on your functioning. And I think that everyone needs to be able to know what is typical for me in my functioning, and am I functioning at this point not typically? And how am I being impacted by what I'm seeing in the news, what I'm seeing on social media? Do I need to take a break from the news? Do I need to take a break from social media and spend some time with myself and really try to figure out, what are my opinions? Opinions are being shot at me all the time. What are my opinions? What do I think and feel? And that's why I think that sometimes if you don't have the ability to do that, that's why mental health services can be immensely helpful. I always tell my clients, and Randy often repeats this, that therapy a lot of times is a conversation with yourself. The mental health professional is a guide in that conversation, but you really are talking to yourself and trying to uncover and really work on this puzzle that is you.
And that process that you work on in session and in therapy, right, is also something that you work on as you become a licensed professional in any of the programs that we offer, right? And so what I always tell folks who are interested in pursuing a master's degree in school counseling or in marriage and family or in mental health counseling is that it's a lot of self-work that you engage in these programs, right? So you'll learn how to tap into that inner self, right? And your thoughts and feelings. You'll learn about your values and sort of what your principles are that guide you in your work. You'll do all of that internal work that also then leads to, right, some sense of being able to sit in uncertainty and deal with uncertainty. So many of those outcomes that we're talking about wanting folks to gain in session with licensed professionals or certified professionals, they'll also gain practitioners will gain as they prepare in pre-service work to enter the field. And so a really big draw, at least for me, when I was looking at counseling professionals, different professions, was that I could go to school and learn more about me, which was a really exciting thing to think about. And so that's something that I think is also important in this time, is to learn a lot about ourselves and really critique who we are, figure out who we are in this world.
Thank you so much, all of you all, for participating in this important conversation. We've come to an end of our programming, but I want to thank all of the panelists and thank you, the viewers, for tuning in. You can view the rebroadcast on BronxNet Channel 67 on Optimum and 2133 on FiOS, and at our website at BronxNet TV. I'm Dorissa White, and I'll see you next time.